Vanity taking cosmetic surgery to a new frontier. Eyelash transplants, the latest procedure available. The new technique, similar to hair transplants, promises longer, thicker eyelashes, but there is a catch. Like normal hair, long lashes need regular trimming. Joining us now is Fox News contributor Dr. Jennifer Ashton. You know, I saw this, doctor, and I was really amazed, but then it makes sense, yet it seems very drastic. How do you transplant eyelashes?
Well, first of all, Edie, it's a brand new procedure, as you said, so that's exciting, and it's still in its infancy. But what is done in this procedure is a small part of your scalp is actually harvested, about 1 to 2 inches, and those contain hair follicles that are living, and those are actually transplanted.
By harvested, you mean cut out? Okay.
That's our fancy word.
All right. Well, you know, I'm simple. You got to keep small words. So they cut off part of your scalp and they take the hair that's on there and they transplant it.
That's right, to your eyelashes.
How do they transplant it?
Follicle by follicle, and it takes about an hour.
Like they sew it on?
It's actually punctured into the lash line, and it takes about an hour per eye, and it is not cheap. It's about $3,000 to $4,000 per eye.
But then the hair follicle, I guess, does transplant. It takes root, literally, and it starts growing.
Exactly. And so, as you mentioned, the one caveat with this is that it will continue to grow just like your scalp hair grows. Now, not every hair on your body grows at the same rate, obviously, but this hair will grow and will need to be trimmed. And we should say also that it sounds kind of laughable and very superficial and cosmetic, but there are actually some medical conditions, such as a condition called alopecia, where patients actually lose their eyelashes completely. So this could be very helpful for them.
Well, I understand that's how this really came out, because you were treating either patients who had, you know, burn wounds where they needed eyelashes put on, they had been burned off, and other things. So
exactly.
You can see the necessity for it, and also then the vanity part of it.
That's right.
But is it taking on? I mean, it's taking off.
I think that just like many cosmetic plastic surgery procedures, it's going to be a big boom, and people should realize that any time you undergo any elective procedure, there are risks involved.
But they don't have to put you all the way under, do they?
No, they don't. Absolutely right. It can be done in an office setting under local anesthesia.
And again, about $3,000, $4,000. How long does it take to recover after they do the plugging thing?
I think it varies from person to person, but there will definitely be a little swelling involved, and there is apparently some itching that lasts for a couple of days, but it varies from a couple of days to a week or two.
Okay, so if you don't mind having part of your scalp taken off, harvested, and then going through that, it's $3,000 to $4,000 per eye, but that gives you, I guess, gorgeous eyelashes.
And they will continue to grow, so they need to be trained and trimmed.
Okay, and the last thing, it's not for everyone. I read that if you have really curly hair, your eyelashes would grow out really curly, so that's probably not for you.
That's right. And certain types of hair or certain types of hair coloring, but if you're sick of the individual lashes and or you have one of those medical conditions, you should think about it.
Okay. It's always fascinating. Thank you very much,
Thanks,
Dr.
Edie.
Jennifer Ashton.
Thank you.
Oh, the things they can do. In a moment here, this dangerous blade.